Hello everybody, Eric Ottinger, licensed professional counselor, licensed clinical addiction specialist, mindfulness meditation teacher, and clinical trainer, coming to you again from Charlotte, North Carolina. This video is mostly for those people who are trying to make sense out of the language of what is addiction, what is recovery, and if you are confused and or frustrated trying to figure that out, you are certainly not alone. So over time, what has happened is that there are large organizations like Alcoholics Anonymous and Narcotics Anonymous that have really claimed the word alcoholic and addict as a really positive thing as part of the recovery process. And within the treatment centers and within the medical community, there is really a constantly changing evolution of what's the proper words or wording to describe a person who is different in a way that they use substances. And some of the older language that has now become more and more obsolete would be the terms substance abuse and substance dependence. So now within treatment centers and within the medical community, much more likely to come across people using the words substance use disorder, and then that is broken down into one of three categories: mild, moderate, or severe, depending on how much that is impacting you. And so whether or not you want to use the word addict, alcoholic, substance use disorder, substance dependence, chemical dependence, or substance abuse, this is a starting point to figure out what separates one individual from another in the way that they use addictive substances. So there's a really basic test. If, when you drink or use, you're not able to control the amount that you put into your body, that is a very strong indicator that you are different than other people. So once you start, if that triggers cravings, urges, and binges, not everybody experiences that. If when you're stopped, there's a lot of thinking about ways to basically more successfully use and control it, to use and not have the negative consequences, and that sometimes this thinking becomes so dominant it's described as an obsession. That's also a very strong indicator. So if you want to go with the most basic test, those are the two questions. What happens once you start? It's not about how often you drink or use or what you drink or use. It's really just what happens once you do. When you are stopped, question number two, do you frequently think about figuring out a way to successfully control and enjoy? And then the third layer that you can look at, a lot of times they'll use this kind of language, is are you experiencing continued use or continued drinking despite harm? Now, this is one of the things that is difficult to figure out because we are going to deal with what I call the myth of the functional addict or the functional alcoholic. And a lot of times in the culture that we live in, the functional alcoholic or the functional addict is very narrowly defined as somebody who still has some money, somebody who still has somewhere to live, maybe they still have a job. And so the question would be to really, are you willing to take a look at expanding the definition of what a functional human being is? And generally, when you get into the clinical conversations, the words roles and responsibilities come up. And then most of us do have some types of roles and responsibilities as a student or as a worker, as a friend, as a family member, as a citizen, as a part of some type of community. And that often as people are drinking and or drugging, that these roles and responsibilities become more and more neglected, that maybe somebody does currently have a job or is able to still remain in school or still has a marriage or a house or a car or an apartment or some money in the bank. So then the next layer of questioning is this: how stable is that? Is that something that you currently have, but realistically, based upon the evidence of history, that at any given moment, if you started to drink or drug one more time, that you'd be rolling the dice? And by rolling those dice, you might be losing those things that are the most important to you. The other thing I wanted to address is if you are now moving beyond the question of whether you or someone you know fits into this category that could be called a substance use disorder, an addict or an alcoholic, or many other terms, and it's not about anybody trying to force any language upon anybody that's you find to be objectionable or that doesn't fit. There are a lot of ways to describe this. But if we can move beyond the conversation of yes or no, either someone I know or myself actually has this different relationship with substances, then the next question becomes what to do about it, or what is recovery? And what is recovery is usually going to focus on 4 different things. Looking at the health and wellness that everybody has in the areas of their physical health, their mental health, their social health, and their spiritual health. And the connection that people lose might be described as a social functioning issue, but it also might be described as a spiritual functioning issue. And for the purpose of this conversation, and usually within all therapy and counseling contexts, we talk about spirituality very generally like this. What is your sense of purpose, meaning, connection? Are you grounded in something that gives your life a sense of satisfaction? That day by day, moment by moment, you have a reason to exist. And that clearly the pain of lacking that leads many people to use addictive substances and many other addictive behavioral processes like binging on food, sugar, technology, work, money, becoming obsessed with other people, and the list goes on and on and on. So what is the message to the people who are watching this that maybe want to more effectively support those who struggle with addiction? Well, it's to take a look at your own self and to start beginning to practice what we call self-care to the best of your own ability, and to really think about the way that you communicate, the way that you have relationships and boundaries, and trying to work on your own, to the best of your ability, honesty, and being able to communicate what it is that you want and don't want in your life. And that, here's the caveat, that honesty is never a license to be cruel. There are ways to communicate messages where you can use what we call I statements. This is what I think, this is what I feel, this is what I want, this is what I like, this is what I don't like, this is what I would prefer. So this has been another short video in the introductory series for Recovery Rebel Revolution, and I hope that this helps.